Today's emergency surgery is on me. I was kind of being a baby in the beginning when I got there.
Well, with our princess, he was a little bit dramatic, but it was good.
I don't mean for this to be such a dramatic video, like, oh, I'm at home recovering from a cosmetic surgery. I've noticed that my hair has been thinning since I turned 25, and I'm not ready to shave my head. So I've decided to get a hair transplant surgery. Oh, wow. Since I'm only educated on performing emergency surgery on fruits, vegetables, and other household objects, but not humans, I'm obviously not qualified to do this procedure on myself. That's why I'm trusting Utah Facial Plastics to perform this extremely complex procedure on me. In this video, I'm gonna walk you through why I chose Utah Facial Plastics, what my pre-op appointment was like, how the entire surgery went, and what the recovery was like 1 to 2 weeks after the procedure. This part of the procedure is so embarrassing to look back on.
Wait, is that all you were doing was making needle holes?
Uh-huh.
Oh, I thought you were slicing.
I panicked during the beginning of the surgery because for some reason I thought Dr. Thompson was using a scalpel to make hundreds of slits all over my scalp that he was gonna put hairs into.
That's why I was freaking out. No, I thought you were like slicing my whole scalp open and I was like, this is gonna be a bitch later. That was literally just needle holes?
Yes! I still don't know why I thought he was using a scalpel. In fact, Dr. Thompson told me specifically during my pre-op multiple times that he would only be poking needle holes.
I'll be making little needle holes through this whole area.
Today is my pre-op appointment, where I'll be meeting with Dr. Thompson at Utah Facial Plastics to discuss the details of my upcoming surgery, which is only 1 week from today. Because there won't be any actual surgery taking place during this pre-op appointment today, I'm not feeling nervous at all. Utah Facial Plastics already did a fantastic job of answering all my questions that I had when we did our consultation earlier this year, and the only questions I really have now have to do with how many grafts I'll be getting, and how those grafts will be distributed across the thinning areas of my scalp. Before I meet with Dr. Thompson, the team here at Utah Facial Plastics is going to take new photos of me to update my file since the surgery is now only a week away.
Towards the camera again, and then put your head down for me.
Taking a picture of my bald spot.
It's exactly what we're doing.
Hey Matt.
Hey, how's it going?
Good. How are you?
Good, thank you.
We're gonna do this, huh?
Yeah, I'm like nervous and excited.
So tell me what you're nervous about.
I'm kind of scared of like needles and scalpel. I think it's a different process to take the hair out versus putting it in, is that correct?
We'll shave this down to a 0. It's already pretty short. We'll be removing those hairs one at a time, and then we're gonna place them in areas that we kind of talked about, which is sort of this frontal area where you feel like you're thinning, right?
Yeah.
Yeah, this whole front area is just not as thick as it is back here. I'll be making little needle holes through this whole area. Kind of a perfect scenario because it'll blend in really well because you have all this natural hair. You won't be able to feel it at all once I get you numb. But the pokes to get it numb are gonna hurt.
Okay.
It's just, there's no way
That's
around
part of it. Is it easier for you guys if the hair is longer?
The shorter is easier.
Should I get like a haircut?
Get it as short as you feel like reasonably comfortable with. So yeah, I think it's going to be a really good result because you've already got a really nice hairline. You have good natural hair, so we fill in the density, and it's going to make a big difference for you.
I have had friends that had a transplant recently, and it seems like most of them want to do another one or like wish they did more grafts.
What I will say about that is it's not always better to push the numbers to as many as you can because at some point the grafts are so close together that they're likely to pop out and you're just going to have a lower survival rate anyway. And so it's better to do one nice dense session, and then if you have to go back and do a second one, it's better than trying to do it all in one session.
That makes sense. Cool.
Okay, Matt.
Dr. Thompson was incredibly attentive during my pre-op appointment, which already has me feeling really relaxed about the surgery. During this appointment, he answered all my questions and he gave me all the information that I was looking for about the procedure. Now I'm meeting with the patient care coordinator, Cindy, to discuss some final details about the procedure, how to prepare for the surgery, what medications I'll be taking before and after the operation, and things to avoid the day of and the day before my transplant takes place.
So morning, you're gonna wanna wash your hair. You do that with this 82S shampoo. It's pretty concentrated, so you wanna make sure that you shake it really well and just use a dime size. The day of your procedure, you're gonna wanna make sure you have a nice large breakfast. You know, bacon, carb, protein. You wanna just have like a solid good breakfast because it is a long time. You'll be able to like take a break and you'll be able to use the bathroom, and then we'll provide lunch for you, whatever you choose. And the girls, the team is really awesome, and so we try to make it as like light and fun and happy. But, it is a little uncomfortable.
Yeah.
No caffeine the day of your procedure. It can increase your heart rate. On the day of, you're gonna want to wear loose clothing. So think of anything to not avoid like pulling up your hair. So a zipper, a button up, some sweatpants, just be really comfy. So before your procedure, you're gonna want to avoid any blood thinning agents such as aspirin, vitamin E, multivitamins, ibuprofen, fish oils, anti-inflammatory medications for at least 14 days before your surgery.
I can already see how valuable this pre-op appointment has been, not only because I got so much more information about how the procedure will go, but the attentiveness of Dr. Thompson and the staff has me feeling completely at ease about my upcoming surgery. It's the day before surgery and it's time to get my final haircut. The staff at Utah Facial Plastics told me they want the hair shaved all around the sides and the back really short, but still long enough that they can see which direction each hair follicle is facing. We're shaving it with the 0 length attachment, which is the shortest that I've had it in years. Usually I'd like to keep my hair a little bit longer to cover up the thinning areas, but I agreed to get it cut shorter on top for the procedure so that the surgeons will have an easier time placing each graft. I didn't want to shave it all the way off because I wanted to leave some of my hair left over to cover up the bloody areas after the grafts are placed. I'm hoping that my hair will grow back quickly during the recovery period so that if I'm out and about after a couple weeks, any leftover blood, scars, or scabs will be covered up. My barber, Brisa, is someone that I've been seeing for the last 10 years, and she's always been able to give me a haircut that I'm happy with despite some of the thinning areas in my hair. I've been taking finasteride for the last 6 months, which is a medication that rejuvenates dying hair follicles, and since this is the first time that I've seen my hair this short in years, I'm shocked at how much thicker the hair has already grown in from the finasteride alone before I've even done the transplant. In the past, my hair was a lot thinner on top, so with it being this short, I was expecting to see a lot of balding in the middle. It's definitely still noticeably thin, but not nearly as bad as I thought it was gonna be.
It is 4:30 a.m. and I can't sleep, so I think I'm just gonna get up, make breakfast, and take a shower and get ready. My ride for surgery is not gonna be here for like another 2 hours, and the camera people won't be here till then, but I hate laying in bed just tossing and turning, so I'm gonna get up and try and do things before the surgery. In 2012, I was addicted to crystal meth, so anytime I have to take medications, I'm really skeptical. I actually do my best to avoid taking medications at all costs. I've been instructed to take Valium before the procedure, which is a muscle relaxer. And I talked to my family about it already and they said that it should be okay. It's not a drug that I was ever addicted to, but because I've never taken Valium before and I don't know how this dosage will affect my body, I'm probably being a little bit over careful, but I'm cutting up the pills into smaller pieces and I'm gonna do my best to only take them gradually throughout the day, taking only a little bit at a time. And if I start to feel nervous or anxious during the procedure, then I can always take a little bit more. They told me to eat a high calorie breakfast with lots of protein and carbs, so I'm making an egg and turkey toast sandwich.
Today's the day of surgery, and I'm feeling really excited to be finally going through with this after years of consideration. I've talked to a couple friends that have had this procedure, and they all say that they don't regret it. They agree that while the recovery period is pretty inconvenient, I'll be really happy that I did it.
Are you nervous?
Yes. My goal today is to take as little Valium as possible. Did you guys know that my driver is actually super famous? So my most viral video is a video of me taking out a crusty retainer, and this is the guy that took it out.
That is true.
And I have received like tens of thousands of comments asking, what happened to that guy? There he is! I'm feeling really confident about how the procedure is going to go today because the Utah Facial Plastic staff and Dr. Thompson have answered all my questions thoroughly and given me a great idea of what to expect today.
Is your heart pounding?
Yeah, it is.
Did you take a value?
I took a little bit. I like broke it up into little pieces. Should I take more?
Yeah. I would take at least the full 5 milligram, and then we can give you another one if you need it.
Okay.
Did you eat breakfast?
I did. I had a huge breakfast.
Okay. Yeah.
You already thought about nervous. It's not gonna be that bad. It's not really bad. Hey, you ready? Yes.
Okay, come on back. Let's start making some markings here. You got a nice short haircut. Perfect.
Oh, good. Yeah, I had her do like a 0 attachment on the side.
Okay. Okay, so what I would suggest, because you're not really receding, you're mostly just thinning, it's kind of like the ideal scenario. A transplant always looks better if you have native hair with it. You know, your hairline isn't high. It really hasn't receded, it's just thin. So we're gonna follow that basic hairline and we're just gonna pack it in here and just make it a lot more dense. And I'll peak this down just a little bit. So this is kind of, and see how it's a zigzag line?
Yeah.
We don't want a straight line because that will look artificial. And this will actually look a little artificial initially because it's so kind of zigzag. When the hair starts to come in, it'll look perfect.
Okay.
And the fact that you already have this hair is sort of like I said, the ideal scenario. To me, it looks like it's thinning from about here forward. Would you agree with that?
Yeah.
Right there. So that's kind of the area we're gonna focus on.
Where are you gonna pull from again?
From back here.
Okay.
So we'll be taking all the hairs individually from back here and placing them up here. And the way it'll work is the beginning,
procedure you'll spend mostly with me. I'll be numbing you up and then making all these little holes where those hairs are going to get placed on the top of your head. And then my partner, Dr. Manning, who does a ton of hair, he's actually going to be harvesting the hair, meaning removing them individually, and then the techs will be placing them into those little holes that I made. So it's kind of like a whole team effort.
Yeah, that
Any
sounds great.
questions?
No.
Okay, so we're going to get you moved to another, we're going to take some pictures and then we'll move to another room and get going, okay?
Okay, sounds good.
Yeah, I mean, you just seem like a pretty, quiet, laid-back, chill guy, so it's amazing. You're like an internet star.
I don't know about internet stars. Yeah, thank you.
Have fun.
It is fun.
Okay, wait right here. I'll grab Julie and get you moved over, okay?
Okay, thank you.
Okay, tough guy, we're getting a picture
Okay.
and then game's on. You ready?
All right. Yes. What was your name?
Julie.
Julie. Have I met you or no? I can't tell because of the mask.
I don't remember.
Okay.
But you're stuck with me all day, so if
Oh,
you
okay,
haven't met
awesome.
me, we're gonna be real good friends. You took the full volume, right?
75% of it.
Did you? What about your pain meds?
I have those with me. Am I supposed to take that already?
Take one right now, yeah.
Hydrocodone?
Yeah.
Okay.
All right, come on back. And then you guys up there all gonna hang out with us?
Yeah, is that okay?
Yeah.
They won't be in there the whole time. They'll just capture like little segments, then they'll leave. We're walking into the OR. There's no turning back now.
Process. We'll get lunch. Okay, so I'm gonna have you take off. You can keep that on, but it's gonna get wet and bloody. You just tell us when you're. I'm gonna get your blood pressure, and then he's going to start to numb you up.
Okay.
And I'm gonna draw your blood while he's doing that. Do you have a in my ass? That's the good thing. Do you want Carnox at the bathroom, guys?
No, thank you. I think if I take that all on vertigo, I'll be fine.
Oh, you're so.
I've been terrified of needles since I was a little kid, to the point that my parents or the nurses would have to pin me down to give me injections.
It'll all be fine.
How you doing?
Good.
Oh, this is Dr. Manning, the one I was telling you about.
Hey, how's it going?
He's
Nice to meet you.
really, he's going to be helping a lot during this case today. I'm going to be doing this first part, so we'll be kind of like tag teaming a little bit here. Okay, so what I'm going to do, I'm going to inject some medication right along your eyebrows here, and it's going to hurt, okay? But it's going to make the top of your head numb for a long time.
How bad is it gonna hurt?
Well, you're going to find out right now. And if you want more Valium or whatever, we can give it to you. Here goes. How you doing?
Something about performing surgery on fruits and vegetables over the past couple of years has actually made me way more at ease around needles, doctors, and surgical equipment.
Put it in really slow, and then it doesn't hurt as much, but it still hurts. So sorry.
Right now, I'm just taking deep breaths and reminding myself that nobody here wants to hurt me and that my fear is completely irrational. Especially because I know that the team here at Utah Facial Plastics has nothing but my best interests in mind and are actually doing work that makes a positive difference in people's lives.
And this area actually is hard to get numb, but putting a block there, it usually makes it numb for several hours. So once I start doing the pokes up here, you probably won't feel this much at all.
That feels kind of weird.
Good.
That's good, right?
That's exactly what we want. We want weird. Yeah, I'm not going to poke for a bit. Okay, so now I'm going to keep going a little bit around the sides, and you'll feel some on the sides. You won't feel anything more on the front. So bear with me here for a minute, and then the whole top of your head's going to be on. These hurt?
Just a tiny
So
bit. Is it painful on the head because like the skin is thin, or there's a lot of nerves?
There's a lot of nerves up here. Now, depending on him, sometimes there can be a lot of blood, and sometimes there's not. So we'll just see.
This part of the procedure is so embarrassing to look back
So
on.
yeah, like I said, it's just going to be a lot of sitting here. So if you start feeling like anxious, then you can take another pill.
I panicked during the beginning of the surgery.
Feel anything there?
No. Because for some reason I thought Dr. Thompson was using a scalpel to make hundreds of slits all over my scalp that he was going to put hairs into.
And what I'm doing now is I just started making the sites where the hairs are going to get placed. And I'm just following your natural hairline.
I have no idea why I thought this, because at no point during this process has anyone told me they'd be using a scalpel on me. It's probably because I didn't get enough sleep.
You okay?
So Dr. Thompson is making tiny needle holes in my scalp. I'm sitting there sweating, breathing heavily, wringing my hands. Even though I can't feel it, I'm panicking because I'm worried that the recovery from this procedure is going to be impossible. As a result of this fear that I'm creating in my mind, my blood pressure elevated and I started to bleed more than usual.
You prefer Matthew or Matthew?
Matthew?
Matthew. It's Dr. Manning. Can I give you It's almost like a flu shot in your arm. It's something called Phenergan, and it just helps to kind of relax you and
You bring your blood pressure down.
bring your blood pressure down.
You are bleeding quite a bit.
Is it okay with you? It's a little drowsy, and it prevents nausea.
Yes, but I was gonna say I'm really sensitive to medication, so could we do like a really low dose and then maybe wait a little bit and then...
Yeah, we could do like a half dose. Does that sound okay to you?
Yeah, that sounds okay.
Okay. Would you like me to use your left arm or your right arm?
Left arm?
Okay. It goes right into your your shoulder here.
Okay.
Just like a flu shot. I'll poke here. That's it.
I still don't know why I thought he was using a scalpel. In fact, Dr. Thompson told me specifically during my pre-op multiple times that he would only be poking needle holes.
I'll be making little needle holes through this whole area.
You can see all these little needle holes that we've made for those grafts to get placed in. All those little spots. Each one of those is going to have a hair follicle placed into it.
Wait, is that all you were doing was making needle holes?
Uh-huh.
Oh, I thought you were slicing. That's why I was freaking out.
No!
I thought you were like slicing my whole scalp open and I was like, this is gonna be a bitch. That was literally just needle holes?
Yes!
My anxiety definitely got the best of me today.
Oh my god. I was sitting here like, oh my god, my whole head is like ripped open. Yeah, so I was freaking... No, I didn't know they were
little
needle
holes. That's like there's
There's
actually no like incisions on your face or head anywhere.
I thought you had a scalpel.
No scalpels.
Oh my god. Oh wow.
Yeah, maybe you can just relax now.
It sounded like...
I was like, yeah, his fear of needles is real here. He's like, really? Yeah, this is tough.
Oh my god. Wow. Yeah, no, I thought that was a scalpel and I was like, oh, he's making
no
like
slices.
slits everywhere.
No slices.
Once I realized there was no scalpel and we all had a good laugh, I was finally able to relax so the doctors could do their work.
Right there.
Did you feel that at all?
No. Perfect.
Even though this realization calmed me way down, they'd already given me the shot of Phenergan, which I'm not mad about because now I feel relaxed and amazing.
Did you want to go use the restroom? You want to take a break?
I think I'm okay.
You want to keep going?
Yeah.
You can go ahead and sit up. If you want to take off the covering on your eye. Go ahead and sit all the way up here. We're going to adjust the chair and get you cleaned up and everything. That's good.
The idea of being wide awake for a 7-hour surgery is really intimidating, but the day is actually flying by.
What's the scar from?
When I was 4 years old, I fell off a couch and hit like the railing of a sliding door.
You okay with that? We got to take it just a little bit shorter.
Yeah, no problem.
You can take the eye mask off if you'd like.
I'm scared to.
You're scared
I'm scared there's like blood everywhere.
Oh my gosh, don't be
We cleaned
scared.
it before we told you.
Don't be scared.
I'm so embarrassed, honestly. I was like having a panic attack.
We don't
No. You know, don't be, you shouldn't be embarrassed about it at all, okay? What I usually do is kind of like just a high and tight. Do you want me to bring it all the way around to the front?
Yeah, if you don't mind.
Because otherwise, I had a few patients after the fact, they were like, oh my gosh, could you please just cut my hair again? Because, you know, it had like a little like patch in the front.
Oh yeah.
So I usually just like to like make it nice and clean so that it looks intentional.
Yeah, definitely. I appreciate that.
Actually does pretty good. Maybe
That's
his second job as a barber.
I was gonna say maybe you were a barber.
Maybe I should be a barber. Table, but does this feel better or worse?
Better.
So what I'm going to do is I'm going to just take the hair from this center portion and we'll keep it pretty high up on your head so that when you fade, you don't see it.
So will there be noticeable like scarring on the back?
If you shave your head short, what it ends up looking like is a small flat of white against your scalp. And because your skin's really fair, you don't end up seeing that. I will always be able to find it, and you might be able to find it, but it's hard to look at the back of your head.
Yeah.
And if you have any length on your hair, then you don't really see it. So you hear anything that's like moving against your scalp or your skull, not your skull necessarily because we don't go down that deep, but you hear it very loudly.
Yeah.
So it's a little bit weird for people, and don't let it freak you out. Beautiful.
Does that sound freak you out?
Yeah. Medicine has me feeling pretty good.
How you feeling, dude?
I feel pretty good. My head feels like a lot of pressure.
You getting pretty tired?
Mm-hmm.
I would have pulled him into the bathroom, but.
I can't believe we're already at lunch and the procedure is more than halfway over.
Tell us how you feeling about all this.
I'm not sure how I feel. Excited that. Is that all the grafts pulled out?
Yeah, everything's pulled out. So now we're just gonna place.
Awesome. I
Yeah.
feel great about that.
Yeah.
Feel good
See?
about that, I bet.
How's it looking back
It
there?
looks like you have a bunch of antholes.
Okay, we're gonna start putting the grafts in. So sorry about that. Where do you feel it the most? Right, top, or
Top
left?
and middle area.
Still feel it?
No.
Yeah, it takes a minute. All right, do you feel this?
Yes.
Yeah? Well, at least now you know how it feels.
Is that the hair going in? Oh. Yeah, it feels the same as the numbing.
Just in case you were curious.
Yeah, it kind of was. Oh, yeah, that hurts.
This?
Mm-hmm.
Are you feeling on the side?
Mm-hmm.
Sorry.
It's okay.
Okay, let us know. You feel that?
No.
You're not feeling anything at this point, right?
Just a tiny bit, but not bad.
Right or left?
Right more. Man, I feel so tired, but everyone has been so amazing and kind, so I feel pretty good. Really tired. I can't tell if I'm tired because I didn't sleep or because of the meds they gave me or both. I don't know what he injected into my arm, but
How do you feel and what do you think about the other procedures right now?
I feel really grateful at how awesome all the staff here has been at Utah Facial Plastics. It's gone like faster than I expected. I feel like they're really efficient. So yeah, I'm really, really tired, but I feel good.
Here's a question. If you could do this again, would you do it?
Yeah. Yeah, I would make sure that I
Needles and
know
all?
that it's not a scalpel. I'm scared about, it feels like they took really big chunks out of the back.
They're just like
Oh, okay. I thought they were like huge. I'm like, I'm gonna have like spots all over the back. It's gonna look.
They're just tiny. I mean, there's little blood spots, but those will heal.
Yeah, do it.
Okay. In terms of like pain, I would totally do it again. Pain's really not that bad.
Yeah, I saw you clenching, man. I don't know what you're talking
Dude,
about.
I swear to God, it felt like he took a scalpel and was like,
No, I was thinking about
and he did it over and over, and I was like, oh my God. And they were like, are you bleeding a lot? And I was like, what the fuck? I was like, I'm gonna get home and be like, I'm gonna die.
But he did like a super good job, like evening it out, like throughout the whole your back of the scalp, like a bigger section. So like it did like a perfect job, like keeping it like super even. So I really noticeable too. Yeah, I don't think you'll notice it at all because I think it'll look really good. I'm excited to see what it's gonna look like in like a couple months.
Yeah.
Here we are back at it again after lunch.
Okay, Matthew, keep plugging away.
Okay, hey, thank you.
You're welcome. We'll check back in from time to time. Dr. Thompson will pop in. And yeah, it's gonna be good.
Okay.
All right.
Thank you. You're awesome.
You're welcome.
All right, Doc's gone. Let's party.
And this is explaining the single, how they go with other graphs.
We're almost done.
The surgery is almost over and I'm almost feeling a little bit sad to be leaving. Granted, I've been somewhat sedated for most of the procedure, but I feel like we were all just starting to bond. I've been a little high maintenance today, asking for water constantly, being fed snacks, taking a lot of breaks, so I'm sure I'm the only one who's feeling sentimental, and likely everyone else in this OR is ready for me to leave.
Is it the last one?
Last one.
What? 13 minutes graph.
How are you feeling? All done.
What?
That's a
All
wrap.
done.
Woo!
Yeah, I mean, it's mainly, you just got to think of these as being really delicate for a couple of weeks. They're hair follicles that we took from the back and moved to the front, and they're just sitting in a little slit in your skin.
Okay.
And they're not stitched in or anything like that. And so if you run a comb through, you could just pull them right out. So you just got to be really careful. And then they'll get a blood supply and they'll become established, and then they're there permanently, and they'll just be like your normal hair, just as strong, just as normal as your normal hair. So
Okay.
you're probably not going to have a lot of pain. This will heal up really quick. I'll probably see you, I usually see you 1 to 2 weeks afterward to look at everything and just make sure there's no sign of infection and make sure everything's looking normal.
Okay.
Sound good?
Sounds good.
Good.
Awesome.
How was the procedure overall?
I think it was really good.
Not too painful?
No, I was a little scared in the beginning, but
Yeah.
it really wasn't that
Thought you were
bad.
slicing his
When
head.
I was slicing his head, that part was scary, yeah.
Oh man. So
But
scared.
it's already healed up, so everything's good.
The visual that I had, I was like, oh my god.
And then like I said, I want to see you in about 1 to 2 weeks. Julie can set it up before you leave, so.
Okay.
All right.
Okay, thank you again. I
Do you
appreciate
guys
it.
want a picture of the back, or did you want a picture of the back?
Yeah.
Okay, just up here. Back here, keep this area clean, 50-50 peroxide and water. And then keep ointment on it, and those holes will close up in a few days.
Okay.
So a little bit of a cup of water with a little bit, pour over, cup of water, pour over, that's it. You're not gonna touch this area for 2 weeks. So when you get in the shower, no water pressure to here. Back here is fine. No hair care products, no blow dryer, you gotta let it air dry, no gel,
For
no
2
foam.
weeks. Okay.
At 2 weeks, the scalp will start to slough off, and then you can kind of gently massage that area. And at that point, you can do whatever you want. It's just activity, heavy lifting, bending over, pressing the base.
Okay.
Anything that elevates your pressure or your blood pressure makes you sweat more than you do.
For how many days? 7 days. Okay. They gave me baby shampoo
Oh, if they give you the baby shampoo, you can use that.
for the first like couple
2
days. Oh, 2 weeks, and then go back to the. Well, they gave me baby shampoo and that other one.
Yeah, if you do the baby shampoo and then switch over to the A2S, you can use that. You can be on that lifelong. The drops I'll send in at 4 weeks. Then when you get them, just start using them. It's like 10 drops. Drop them on there and then use the dropper tip and spread around. Don't use your fingers because then you just wasted it all. That's pretty much it.
How long do I keep this on?
Tomorrow. You take it off tomorrow. It's just mainly one to protect, give you a little bit of pressure for back there so you don't get bleeding.
This has been such a positive, memorable, and surprisingly pleasant experience, and I just know I'm gonna remember this day forever.
All right, everybody, wave to the camera for a job well done.
Where are we standing? In front of the chair?
Yeah.
For sure. You're definitely like the most interesting person in this. So.
No, you guys are.
Well, with our princess, he was a little bit dramatic, but it was good. He's gonna have great results. His grafts were awesome, a lot of multiples. After feeding him, getting him numb, it worked out great. We're excited to see him in a year and then follow up with him the next 3, 4, 5 months.
We are done here.
Yes.
Yeah.
Bye, Wendy.
Like what?
No, actually not. Okay, awesome. Thank you, you too. Appreciate it. Woo! I cannot believe that's over. It kind of like went faster than I expected in a way. We got done by 2, so.
Yeah.
Oh god, so you both have footage.
Mm-hmm.
Oh man. I got home from surgery about 2 hours ago, and because I didn't sleep much last night, I was super tired. So I slept. Actually surprised I was able to sleep, but I feel really good right now. And when I got home from surgery, I noticed that the numbing was starting to wear off, and I was starting to feel some stinging. So I took 5 milligrams of hydrocodone and some of the other medications they gave me, an antibiotic and a steroid that's gonna assist with some of the swelling. I'm supposed to sleep elevated as much as possible, but I'm not gonna lie, that was challenging, and I was so tired, so I did kind of lay all the way down. I notice when I actually smile or laugh, I feel a little bit of stinging, so I'm gonna try not to do that. I read that the worst thing someone could do after surgery is not follow their doctor's instructions, so I am gonna do my best to sleep elevated as much as possible from now on. Utah Facial Plastics also gave me a bag of some things, which is really nice. Got this neck pillow that I'm gonna use, and this will definitely assist with the sleeping elevated. Gave me an awesome cup, thank you guys. Love these. And they gave me some pads that I can lay down on my pillow while sleeping. And this one's really important. This is a spray bottle that has a water and saline solution. And my instructions were to spray this over the grafts once every hour for the next 5 days. So I guess I missed an hour, so I'm gonna make sure I do this too properly. I thought that might hurt, but it doesn't at all. So they told me that I want to keep the grafts like a little bit moist, but not like drenched. I don't know what else to say. I'm honestly impressed. That did not feel like a 7-hour procedure. I had a lot of fun. I didn't expect to have fun during a 7-hour surgical procedure, but the staff at Utah Facial Plastics were seriously awesome. They took great care of me. I was kind of being a baby in the beginning when I got there, but they were patient with me and answered all my questions and walked me through everything they were doing, which ultimately assisted me in relaxing and made it way easier to get through the rest of the procedure. Yeah, I don't know what else to say. I can't believe that the procedure's over. Now the hardest part is the recovery, obviously. I'm really excited to see the results. They did 1,300 grafts, which is really gonna fill in and thicken kind of the front area of my hair. But I knew going into this procedure that the healing and recovery process for a hair transplant is a long process. It's normal that in a couple weeks, all of the grafts are gonna actually fall out. And then as the follicles grow into place and get blood supply permanently, the hair will regrow. I think it's gonna take about 6 months for hair to be noticeably growing in, and it's gonna really take a year to see the full results. I'm gonna really get to learn what patience is this next year. Ultimately, I'm just feeling a lot of gratitude. I just am still blown away at how fast the procedure went. Like, that did not feel like a long day at all. That felt like as fast as going to the dentist. Like, I think going to the eye doctor is harder than what I just went through with this, because I hate the eye doctor. Yeah, I'll keep you guys updated. It's about 6:30 p.m. my time. I'm really excited because Taylor Swift has a new album tonight at midnight. It's October 20th. So at midnight, October 21st Eastern time, Taylor Swift is releasing a new album. And I'm excited to just chill tonight, listen to her new album, relax, and sleep a lot. I've been filming so many videos this past year and I tend to be a little bit of a workaholic. It's challenging for me to just sit still and do nothing. So my goal this week is to really allow myself to rest and let my body recover without pushing myself too hard. I am gonna film these updates, I'm gonna be compiling footage, but I'm gonna try not to do much work around the house. I might do another update before I go to bed tonight. For now, I'm feeling pretty good. I didn't expect to be feeling this good 2 hours after surgery. I'll give you guys another update tomorrow.